Hello, my name is Hannah Speight. I am a medical technician, and I wanted to go over the surgery that you have scheduled later today and answer any of the questions that you might possibly have. So, a little bit about Mohs surgery. It is the most effective technique for removing BCCs. It allows minimal damage to healthy tissue and has shown the highest cure rate. The goal of the surgery is to remove the visible tumor and a very small amount of tissue around and beneath the tumor site. The tissue will be color-coded in order to have the most precise location. The surgeon will then use our on-site lab in order to examine the tissue under a microscope and see if any cancer cells remain. If so, which is likely it will happen, if so, we will just go back in and take out little by little until no cancer cells remain. The type of skin cancer that we will be removing today is basal cell carcinoma. It is the most common form of skin cancer and arises when abnormal and uncontrolled basal cells form. This can happen from DNA damage, from exposure to ultraviolet radiation, from the sun, or even indoor tanning. Basal cells are triggered, causing uncontrolled growth and changes to the epidermis, which is the outermost layer of skin. Considering your background in growing up on the beach and having a pale complexion, it is very, very common to form this type of cancer. So Mohs surgery will be performed by a team of specially trained doctors. A surgical oncologist will be the one to remove the cancerous tumor and also the tissue. A histotechnician will then prepare the sample to be examined. A pathologist will analyze the tissue. And then finally, a surgeon will close or reconstruct the wound if needed. Some of the instruments that will be involved in Mohs surgery include a scalpel, fine forceps, scissors, and even possibly an electrosurgical device for coagulation. The procedure, it can take anywhere around 4 hours is the typical amount of time. However, our surgeons typically tell the patients to give it all day just in case means necessary. It ultimately depends on the amount of cancer cells present, and it's impossible to determine that until the process has begun. The discharge instructions are extremely important to follow. So there's minimal scarring. Sunscreen usage on the scar or other forms of skin protection are very helpful for at least 6 months or so after the surgery is done to help optimize scarring. It is important to follow the physician's instructions for wound care and sunlight protection. Mohs surgery uses a precise technique that has the highest cure rate for any treatment for the most common skin cancers, such as basal cell sarcoma, which is the one that you have. It is able to save the highest amount of healthy tissue, leaving the smallest scar possible. So that's great news considering it is on your cheek right there. Great news. And also another thing, strenuous activity is recommended to be limited for at least 7 days after your surgery to allow your wound to heal and prevent bleeding or damage to your stitches. We can remove the stitches 5 to 10 days after your surgery, and I can look at the calendar right now with you and figure out which day will work best with your schedule, and we can get this appointment taken care of. Thank you.